Hey there, and welcome. Today, we are going to pull back the curtain on something we all go through, but maybe don't fully understand: the physical checkup. We're going to demystify the whole process from the first question to the final plan. So, let's dive right in. You know that moment you're sitting on the exam table listening to that crinkly paper, and you just wonder, what is my clinician actually looking for when they listen and tap and press? What's the method to the madness? Well, that's exactly what we're going to break down today. So, first things first, a physical exam isn't just some routine you have to go through. You got to think of it more like a really important data gathering mission. Every single step is designed to build a complete picture of you and your health. So, what's the point of this whole mission? Well, it's really threefold. First, it's about getting a solid baseline of your general health. Second, and this is a big one, it's to spot any underlying health issues, sometimes way before you'd even notice any symptoms. And third, it's all about education, giving you the tools and info for preventative care so you can stay healthy for the long haul. Now, before any stethoscopes or blood pressure cuffs even come out, the exam begins with the most powerful tool there is: just talking. This is where you get to tell the story of your health. Your health history is basically the foundation for the entire assessment. It's a mix of your personal story, past illnesses, surgeries, any medications you're on, and your family story, which can point to potential genetic stuff. Giving this whole picture is absolutely vital for your clinician. Okay, so once that story is on the table, the clinician kind of becomes a detective. They use these four fundamental techniques to gather all the physical clues about what's really going on inside your body. And here they are, the four core techniques that are kind of like a clinician's super senses. You've got inspection, which is looking; palpation, which is touching; percussion, which is tapping; and auscultation, which is listening. Let's break down what each of these really means. All right, inspection is pretty much exactly what it sounds like. It's a really careful, detailed visual lookover. Your clinician is using their eyes, but also their sense of smell and even hearing to check for anything out of the ordinary. They're looking at things like your skin color, if things look symmetrical, and even for tiny clues, like a certain scent on your breath that could hint at something else going on. Next up is palpation, and this is all about the power of touch. Using their fingertips, a clinician can literally feel for things they can't see. With just light pressure, they're checking out your skin's texture and temperature. But with deeper pressure, they're feeling for the size and shape of your organs, or checking for any unusual bumps or tender spots. Then we get to percussion. This is a really cool technique that involves tapping on your body almost like playing a little drum. Seriously, the sound that bounces back tells a story. A dull thud over the chest might suggest fluid in the lungs, whereas a nice, hollow sound is exactly what you want to hear over a healthy, air-filled lung. And finally, we have auscultation, which is a fancy word for listening. This, of course, is where that iconic stethoscope comes into play. It amplifies all the internal sounds of your body, letting the clinician hear the rhythm of your heart, check for murmurs, or listen to the air flowing through your lungs for any of those telltale crackles or wheezes. Okay, now that we know the detective techniques, let's take a quick look at how they're used in that systematic journey through the body, the famous head-to-toe assessment. Now, a full exam is way more detailed than this, but the journey generally follows this path. It kicks off with the head and neck, then moves down to the chest for the heart and lungs, and then onto the abdomen to check on your digestive organs. And at every single stop, the clinician is using a mix of those four techniques we just talked about. For example, when they're listening to your lungs, it's not random at all. There's a very specific pattern they follow, moving the stethoscope from one spot to the next on your back and chest. This lets them compare the sounds from both sides and make sure every single part of your lungs gets a listen. It's like they're following a map. So, along with that hands-on exam, there's another crucial set of data being collected: your vital signs. These are the hard numbers, the objective measurements that give a quick snapshot of how your body's most basic functions are doing. The key vitals you'll always hear about are blood pressure, heart rate, breathing rate, temperature, and oxygen saturation. But, pain is often called the sixth vital sign. Taken together, these numbers tell a really powerful story about what's happening inside you right now. Let's zoom in on one of the most common ones: blood pressure. For an adult, a normal range is usually somewhere between 100 to 140 for that top number and 60 to 90 for the bottom. We all know that classic 120/80 average, but what do those numbers actually mean? Here's a super simple way to remember it. That top number, the systolic, that's the pressure during the squeeze, when your heart is actively contracting to pump blood out to your body. And the bottom number, the diastolic, that's the pressure during the relax phase, when your heart rests and fills back up with blood. Just think, squeeze and relax. You might also hear some medical lingo about your heart rate. If it's ticking along below 60 beats per minute, that's called bradycardia. Brady just means slow. And if it's racing over 100 beats per minute, that's tachycardia. Tachy means fast. It's really just shorthand for how fast or slow your heart is beating. So the big question is, how do all these different pieces, your story, the physical clues from the exam, and the hard data from your vital signs, all come together? Well, they're all combined to create one single coherent picture of your health. This process here shows the whole workflow perfectly. The clinician collects objective data using their senses. That's the inspection, palpation, percussion, and auscultation. Then they check all of that against your subjective health history, which is your story. And from that combination, they develop a plan of care that's made specifically for you. So the next time you're at a checkup, you'll know you're not just sitting there passively. You are the #1 source of information in this fascinating investigation. And it really leaves us with one big question to think about. What story is your health telling today?